Welcome to Living Healthy Chicago. I'm Jane Klaus. Today we're focusing on heart health. So it's important we understand how to keep our hearts healthy. And who better to join us than a cardiologist? Dr. Clyde Yancey of Northwestern Medicine is the go-to guy when it comes to all things heart-related. So lucky for us, he's here today to answer all of our questions. Dr. Yancey, I think we need to first start the conversation off with what's on everybody's mind, and that's COVID-19. Can it actually affect the heart?
COVID-19 isn't just a virus that causes pneumonia. Boy, does it ever do that, and it can be fatal. But there are also cardiovascular complications. The heart can experience weakness, sometimes because it's overworking in response to the pneumonia. There's very disturbing evidence that COVID-19 is associated with the development of blood clots. We've been able to identify that even months after the COVID-19 exposure, we were able to find in some people evidence the heart is not functioning as well as it should. We believe it gets better over time, but this is something that we'll have to use a longitudinal, long-term lens to see, is this one of those things that we need to anticipate? So we can only follow this out as it evolves and learn as we go.
We're all under a lot of stress these days, whether it be the stress of, am I going to get sick? Will I keep my job? So how is stress connected to heart health, and how can we best manage it?
Stress in and of itself drives illness. It drives inflammation. I see blood pressure fluctuations that clearly are associated with stress. I see episodes of chest pain clearly associated with stress. Stress matters, and it leads to dire consequences in a lot of people. All of us have to dig deep and say, what's my go-to activity that helps me dissipate, manage, control my stress? Some people are meditating. Some people are reading. Some people are exercising. People that are doing constructive things are really helping to improve their health.
Let's talk about high blood pressure. What are some ways to manage a high blood pressure?
It's so closely connected with weight. It's so closely connected with stress and lifestyle. It is so closely connected with diet. We all need to trend towards a diet that is very robust in plants, lots of fiber, lots of fruits and vegetables, very low in saturated fat, low in sodium, and know your family history. You know what? If your parents and grandparents had high blood pressure, guess what? You're probably in that same space.
Can you help us make the connection between sleep and heart health?
Such a marker of the adequacy of our own health, getting appropriate rest, and it's been really hard to do in this pandemic. So I really do think it's important for everyone to consider, how can I improve my sleep quality? Well, I'll give you some tips. Avoid the big meal late at night. Avoid blue light in bed, reading your screens. No. Really think about how you can make your process of going to sleep a more peaceful, a more welcoming process.
In your opinion, what is the one lifestyle change that can make the most benefit on someone's heart?
It's diet, but oftentimes it's a simple thing in diet. If you're a fan of sugar-sweetened beverages, think about something different. If you're a fan of fried foods, think about a different way. Make one change in your diet for your health and stick with that change. Whatever it is, that's a huge first step, Jane, and it's something everybody should think about.
All great information, Dr. Yancey. When we come back after the break, we're going to continue our conversation about heart health.
Sounds good.
So if you like this video and want more living healthy, just subscribe to our channel.